thank you so much for tuning in to KBTV. I'm Dr. Karlisha Booze. For today's Wellness Wednesday segment, we're talking about monkeypox, which is a rare disease caused by the monkeypox virus. Right now, the CDC is currently tracking multiple cases in different countries, including the United States. And today, we're joined by Dr. Jennifer Hoffman. She's with Piedmont Macon. She's an infectious disease specialist, with Piedmont Macon, and also a professor at Mercer University School of Medicine. So thank you so much for joining us, Dr. Hoffman.
Oh, it's my pleasure. Thank you for having me.
Absolutely. So right now, what do we know? How many confirmed cases? Well, let me go back just a little bit. What is the monkeypox?
Right. So monkeypox is an orthopox virus that's closely related to smallpox, cowpox, other poxes you may have heard of. It's less serious than smallpox, and it is there's been small outbreaks in kind of Western and Central Africa for several decades, but it's a little bit unusual to be having it in other parts of the world, including the U.S.
Okay, so right now, are there currently any cases in the United States or Georgia?
Yes. So as far as I know, last I checked, there were 34 confirmed cases in the United States, of which one of them was in Atlanta, Georgia, or the Atlanta metro area. Mm-hmm.
So do you expect to see any cases in Middle Georgia?
I think it's hard to say exactly how far this is going to spread. I'm certainly not expecting to see huge numbers. I mean, we could have a small number of cases. It's within the realm of possibility. My understanding is that the Atlanta man is currently in isolation. So hopefully he's not passed it on. And, maybe we will, maybe we won't, but I'm not expecting to see large numbers.
Okay. So how contagious is this? Is it something that's airborne, or, you can, if someone is around you, you can touch them? Like, how contagious is this disease?
So I would say it is not particularly contagious. So it is contagious mostly by direct skin contact with the lesions, the skin lesions of a person who has active monkeypox infection. It is also possible, but less probable, to acquire monkeypox by, say, touching the dirty clothes of someone who has monkeypox infection. Some of the pus from their lesions got on, say, their underwear, and then you touch that. In theory, you could contract it that way, or a prolonged exposure to their respiratory secretions, such as, kissing. And I don't mean to peck on the cheek, but that sort of thing. So it requires fairly close, intimate contact. It's not that easy to catch.
Okay. What are some symptoms? When I think about, monkeypox, I'm thinking about smallpox or, chicken pox or something like that. Are there any bumps or rashes that people may see? What are some of the symptoms that you guys have found through the research?
Sure. Well, I want to emphasize I have not personally ever seen this disease, but from what I know as an infectious disease doctor, what I can tell you is the incubation period is typically 7 to 14 days. So about 1 to 2 weeks after exposure is when you'll start developing symptoms. And typically at first is things like fever, chills, muscle aches, headache, things like that. One thing that's characteristic of monkeypox that is not characteristic of smallpox is you'll also get enlarged lymph nodes. We call that lymphadenopathy. Then a few days after those kind of generalized symptoms start, you'll start getting small bumps on your skin. And those bumps eventually turn into kind of fluid-filled blisters that then turn into small kind of craters or ulcers. And then they dry up and go away.
Okay. So I would ask, I know you said that you may not, you can't really tell if you're seeing it in Middle Georgia, but I'm curious to know, is it deadly?
It can be. So I've seen mortality rates quoted as anywhere from 3% all the way up to sometimes 10% in Central Africa. But I suspect that has to do with the lack of access to advanced medical care in that area. I think what I've seen, in areas with better care is about 3 to 6% mortality. So, yes, it can be deadly, but most of the time it's not.
Okay. So what are some recommendations that you could give just for our viewers, just to stay safe out there? Obviously, we want to stay washing our hands and all the basic stuff, but what are some, obviously there are not any vaccinations right now because it's fairly new for us, right? So what are some recommendations that you could give or, tell us?
Yeah. So on the question of vaccination, technically speaking, there is a vaccine for smallpox. And so, that vaccine is being offered to, say, lab workers who are working with monkeypox. For the average risk person, it's just not necessary at this point in time to get vaccinated. Which is unusual for me to be telling people to not rush out and try to get vaccinated, but the risk benefit ratio is just not there for most people that are worried about monkeypox. So I would not be terribly concerned for the average person about acquiring monkeypox. You're highly unlikely to do so. As far as what you can do to stay safe, I would say the main thing would be to avoid touching the skin lesions of someone who has, a rash of unknown etiology. Just don't touch open skin lesions. That would be the main thing. And, in theory, it can be passed on by, kissing too. So, I guess, maybe avoiding, making out with strangers. I'm not even sure what to say about that. But, that's how it's passed. It's either by direct contact with the skin lesions or via, contact with infected, clothes, bedclothes, things like that, or prolonged kissing. So most people don't really need to worry about this, at least at this point in time. If we start seeing large numbers of cases, that'll be different, but I'm not really anticipating that.
Okay. Well, thank you so much, Dr. Hoffman, for this helpful information, and we hope that everyone stays safe out there.
Yeah.
Are you a homeowner, a parent, or own a business? What happens to those assets in the case of death?
Hi, I'm Cassandra Barron, your local life insurance agent. Life insurance protects your income in the case of death. Call me for your free quotes today.
Affordable coverage for the whole family, immediate coverage, no waiting period, multiple kids coverage for one price. Call Cassandra Barron today.